All right. Hi, this is Dina Swartzkopf, and this is health assessment class 6511 for Walden University. What we're going to be doing here today is the head, eyes, ears, nose, and throat. And this is Gary. He is my husband, and he's volunteered to be a participant today. So what I'm going to do is I'm going to start by palpating the head and looking for any abnormalities here. I think it'll do better to have you do that. Yes. So what I'm going to do is I'm going to start in the front, and I'm going to palpate. I'm going to look for any softness, bruising, tenderness, sores, occipital area back here. Have you had any head trauma before?
No.
Okay. No fractures or anything like that? Okay. There's no bumps or anything like that? Okay. So that's all normal. And then basically what I'm just going to do is I'm just going to check the mastoid area and then the frontal area here. And just looking for any kind of lumps, bumps, sores, anything that's out of the norm for that. And that seems within normal limits. So I can have you turn back this way. What I'm going to do next is I'm going to look at Gary's eyes. Check this out. Okay. What I want you to do, I'm going to turn this way. I'm going to look in your left eye first. And what I need you to do is just look over my shoulder. And looking for the red reflex. There it is. And I'm going to move in. Okay. That looks good. I'm going to move over to the right eye. The red reflex. Okay. Now I'm going to move in. Okay. And that looks normal there. Have you ever had any eye trauma or anything like that? I'm looking for any kind of discharge, redness, soreness, swelling, irritations, pterygiums, ptosis, drooping of the eyes, entropions, ectropions, and everything here looks normal. Conjunctiva is nice and pink, nothing red. Do you wear contact lenses?
Yes.
Have you had any trouble with contacts as far as infections, uveitis, anything like that? Okay. So next what I'm going to do is do the vision test or the visual fields test, and it probably would be better to have you look this way. I'm going to just have you look at my finger, and we're going to have you just watch my finger as it comes in. Okay. And out. Special finger. Okay. While I'm doing this, I'm also looking at the constriction and dilatation of your pupils to see if this is normal, because your pupils will tend to constrict as you're looking at objects closer, and will dilate a little bit as you're looking at objects over in a distance. So look at my finger, and then look up over my shoulder. And I can see your pupils constricting and dilating, so that is normal response. What else I'm going to do for checking your visual fields is, okay, peripheral vision. So there you go. What I'm going to do is I'm going to stand over you, and when you see my fingers, I want you to say okay or whatever. So when you see my fingers, just say yes.
Yes.
Okay. And I'm going to check for your side here.
Yep.
Okay. And
yep.
Okay. And then I want you to follow my finger again, and just watch your eyes. I'm going to go out, up, back, down, up, back to the middle. Okay. Switch over, out, up, middle, down, back, and over. Okay. That was all good. Our eyes were able to follow. So what I'm going to do next is we're going to do the ears. And what I would like to do first, I'm going to have you hold this. I'm going to pull on the pinna and see if there's any tenderness or soreness. Do you have any tenderness or soreness in the tragus, the pinna? Tragus? No soreness or anything? No. Okay. I'm going to do that before I put anything in your ear to make sure that there's no soreness before I put anything in. What I'm going to do here is I'm going to pull up and back, and I'm going to kind of support your head here. And look in your ear. That looks very good. I'm not seeing any bulging. It's pretty gray. And I can see the landmarks. And that looks really good. So I'm going to look over on this side. Support your head. And the same on this side. No bulging, no redness, no swelling. A little bit of earwax there, but otherwise that looks really good. So after looking in the ears, what I'd like to do next would be a hearing test. And the first test is called the Weber test. And so what I'm going to do is I'm going to check for sound conduction and see if how Gary hears this. So I'm going to put this on his top of his head. Where can you hear the
Both ears.
Vibration? Okay. The other thing that I'm going to do is called the RIN test, and I'm going to check air conduction and bone conduction. So tell me when you don't hear that any longer.
Okay. Yeah. Yeah.
Very good. We'll do this on the other ear.
Okay. Okay.
Okay. Very good.
Yeah.
Okay. So the ears look good. There's no edema, swelling, drainage. There was a little bit of earwax in here, but that's a normal finding. And no tenderness. So what I'm going to do now is I'm going to look at the nose. And I'm looking at the contour of the nose, and I don't know if you can turn your head or not, and I don't know if you can see this, but it looks like you've broken your nose. Have you
Yes.
had some nose trauma in the past? Okay, what's happened? Were you just
childhood?
Just childhood, just plain.
Yeah.
Okay. So what I'm going to do is I'm going to have you look up at the ceiling, and I'm going to look in your nose, and looks good here. Look over on this side here. There is a patch up in your nose. So did you have surgery on your nose?
Yeah, rhinoplasty.
Okay, I can tell there's a patch in there. Was there a deviated? Yeah, you had a deviated septum, didn't you? I think you did.
Yeah.
I don't see any nasal polyps. Can you breathe okay? Are you having any trouble breathing? Okay. No drainage?
No.
Nothing that you know of? Okay. And what I'm going to do next then is I'm going to check your mouth. And I'm just going to palpate around here first, just checking for tenderness. And it does look like you have a little cold sore here.
Yeah.
Right there. Okay. I'm going to check your TMJ, and so I'm going to have you open your mouth, close it, open, close. And there's no popping of the jaw, so that's good. Next, what I'm going to do is I'm going to have you open your mouth, and I'm going to look inside. Yep. Yeah, it looks pretty good. You don't have a uvula, so is that part of the surgery that you had? So you had basically a septorhinoplasty.
Correct.
Okay. Also, what I'm going to do, I'm looking at your soft palate, soft palate, hard palate, and there you go. You lifted up your tongue, so I'm looking at your salivary glands here, and that looks all normal. And I'm going to check your tissues, just check for any kind of lesions on the inside, and just kind of check the condition of your teeth. Okay, I'll just have you open your mouth again, and what I'm going to look for here is just any kind of sores, lesions. Gums look good. There's no offensive odor coming from your mouth. Your teeth all look like they're in very good condition, so that's normal finding for you. Okay, so what we're going to do next, so I'm just going to have you smile. There you go. and then stick out your tongue and go. Okay. And once again, bite down. Do you have any trouble chewing, biting, anything like that?
No.
All right. What I'm gonna. So what I'm gonna do next is I'm gonna check the lymph nodes, and so I'm gonna basically start up in this area here and check on both sides. And I don't know, it might be better to have you turn sideways. We're looking at the pre-auricular and the post-auricular, and then the submandible or tonsillar, submental, and then cervical, superficial cervical, and then deep cervical, and supraclavicular. And what I'm looking for is anything that's a lump that might be tender or hardened, non-movable. Those would be, if it's non-movable or extremely tender, and Gary does not have an infection, that would be something that we would need to send to a specialist to have check out. What else I'm going to check for is your temporal artery. Okay. And I'm going to check your thyroid. So let's see. I'll have you come back. And what I'm doing, I'm looking for the cricoid bone, the cricoid area, and just basically at the clavicular notch. And what I'm going to have you do is I'm feeling for the isthmus, and I'll have you swallow. Okay. As Gary swallows, that isthmus moves up and down, and I can feel that. I do not feel any irregular borders or any kind of enlargement. You don't have any thyroid problems that you know of, do you? Okay. So that is normal. I'm also going to check for any kind of tracheal deviation. So I'm going to kind of press on the sides here. Feel anything there? Oh, sorry, it kind of hurt there. And that's normal at this time. I'm going to also listen for any kind of bruise in your neck. Okay. And what I'm looking for is anything where I hear kind of a whoosh, whoosh, whoosh sounds, which telling me that there might be some kind of a constriction in there where the blood flow is having a hard time getting through the vein or the artery. Okay. This concludes my assessment of the head, ears, eyes, nose, and throat, and we'll see you for the next assessment. Thank you.